Japan's population, keeps getting older, and the pace and the impact of aging vary a lot across prefectures. So we really needed to understand what's happening at the local level, not just nationally. And if you look at only national level data, you miss important difference between regions. And actually, without that kind of breakdown data, local governments don't really understand and don't really know what specific health issues they should be focusing on. Then, the GBD framework makes this possible. It gives us comprehensive and standardized data that we can compare across different prefectures over time. That is super important for understanding where we need to take action. We found some really interesting results and trends. Life expectancy is now about 85 years in Japan, but the gap between life expectancy and healthy life expectancy has widened. It's now over 11 years. So yeah, basically people are living longer, but they are spending more time dealing with health issues. And the big thing is the growing health disparities between prefectures. Now there is nearly a 3-year difference in life expectancy, depending on, where you live. Also, yeah, Alzheimer's and other dementia are now the #1 cause of death in Japan, which is a huge shift. And mortality rates for major conditions like stroke and ischemic heart disease and lung cancer and others, they have improved a lot over the decades. But we are seeing those improvements now have been slowing down. So all of this data tells us that we really needed to rethink about how we approach public health in Japan. Over the last 30 years, Japan's life expectancy went up by about 5.8 years. But at the same time, the gap between life expectancy and healthy life expectancy widened. It went from about 10 years to 11 years now. That basically means, people are living longer, but are spending more time with health issues. And what's really concerning is that health gap between prefectures are growing. So the difference in the life expectancy between the different prefectures used to be 2.3 years at maximum before, 30 years ago, but now it's 2.9 years. And for men, it's even bigger. It went from 3.2 years to 3.9 years, which is a quite jump. The figure too, shows the like a pretty concerning trend. The blue color indicates large difference between the healthy life expectancy and life expectancy. And red color means the very narrow the difference. I mean the gap between health expectancy and healthy life expectancy. So there's the regional trend. Northern area has less likely to have a bigger, the gap between life expectancy and healthy life expectancy. But the southern area shows a higher gap. That means that people in those areas are more likely to spend more years with disability. This difference are not just about healthcare access. They may have a lot to do with complex interactions between health system performance and social determinants of health, which depends on prefectures. So yeah, if we really want to improve health equity across Japan, we also needed to look at these deeper social and economic differences between prefectures. This research actually comes at a really good time because Japan just started the new phase of its national 10-year long health promotion strategy, which is called Health Japan 21. So yeah, I think local governments will be able to use our data in order to focus on their own specific health challenges. For example, some prefectures might need to invest more in dementia care because it's now the leading cause of mortality in Japan. And others might need to work more on reducing mortality risks for major conditions like a stroke and ischemic heart disease. And regarding the growing gap between life expectancy and healthy life expectancy, it really tells us, we needed to focus more on improving quality of life, not just simply extending a lifespan.